The further assessment of the cranial nerve examination include assessment of the third cranial nerve, fourth cranial nerve, and sixth cranial nerve. This cranial nerve can be examined together, which is the usual clinical training sequences or technique, or can be examined individually, as I will show it just a few moments later. Really, if they are examined together, we have the following three steps, and each step is subdivided further into three findings or steps. The first step is a prime position. In the prime position, check whether the patient had proptosis, ptosis, or pupillary inequality. This is the first step, prime position. The second step is to perform the H test. From the H test, you can note whether the patient had any nystagmus, ask him about any diplopia, and note whether the patient had any limitation of his extraocular muscle movement. The third step would be the pupillary reaction to light, both direct and indirect, and lastly the accommodation test. I'll show the sequences of examination in the following manner. First of all, I'll check for a prime position. I'll put a pen in front of the patient. هستباوع على هذا القلم to see whether the patient had ptosis, proptosis, and I'll check for pupil, whether they are equal, symmetrical, or not. This is the first step. This is the prime position. The next step would be the H test performance. I'll check for the findings in the following manner. حماده هسه شريدك هسه تباوع لي، تباوع القلم. وين ما يروح القلم اريدك تحرك عيونك وياه بدون راسك، بدون حركة راسك، فقط القلم تحركه. هسه هنا اوكي، هنا اشتدك، هسه هنا، هسه ترجع للنص. هسه راح اشيك لك هاي الجهة، تباوع لفوق هنا، عفوا، هسه تباوع لهنا، هسه راح ارجع لك للنص. اوكي، اكو شفت عندك القلم صار صورتين بأي منطقة من ضمن المناطق تشيكناها نهائيا ما صارت. So I'll notice whether the patient had any limitation of extraocular muscle in the eye movement or any nystagmus, and I asked him about diplopia. Really, nystagmus oscillation of the eyeball, of the eye, and it is of two types, either jerky or pendular. Jerky is classified into vertical nystagmus and horizontal nystagmus. Vertical nystagmus can be further classified into upbeat nystagmus and downbeat nystagmus, and so on. If the patient had diplopia, we can further assess it later in the form of cover test. Really, these are the H test examination. After that, I'll check the reaction of the eyes, or mainly the pupil, in the form of direct and indirect in the following manner. I'll check this eye. هسه تبقى تباوع اللي هيجي. Okay, so the pupil is reacting. This is for the direct. The pupil became small, and I'll see the other pupil while I am shining the light for this eye. After that, I'll check also the direct for this eye. Okay, and to see how much it is constructed, and then the indirect by shining a light here and to see the constriction here. Okay, after that I'll check for the accommodation test. I'll ask the patient to look for a far object and then to look at an object with about 5 inches from the eyes of the patient. هسه بدك تباوع على الطرف مال الغرفة، تباوع عليه. هسه تباوع على القلم. Okay, the patient had the triad of ptosis, convergence, and meiosis. So he had accommodation test is intact. Really, sometimes when the patient had what we call it afferent pupillary defect, we can use swinging light test in the following manner. The swinging light test, just like this, shine the light here and then immediately here, and to see the pupillary size with the direction of the light. Normally, when I direct, for example, the light here to my left eye, I'll see that the pupil is constricted, and also indirectly this pupil will also be constricted. This constriction here is more stronger than the constriction here because it is direct. Also, when I check this eye, I'll see also narrowing or constriction of my right pupil, also a little bit stronger than the constriction here. Swinging light test is designated just to assess whether the patient had Marcus Gunn pupil or not. Marcus Gunn pupil mean afferent pupillary defect, that's to say the optic nerve is affected. Those who had optic nerve defect, they will show dilatation instead of constriction. Why? Because the light reflex is subserved via the optic nerve as an efferent and the third cranial nerve as an efferent. So if I have a defect here, for example, in my left optic nerve, when I shine the light here, I have afferent pupillary defect. That's to say, though, there is no reception. So the eye, especially if it is blind, so the eye will never constrict it. Okay? When I shine the light to my right eye, there will be constriction because it is the indirect reaction. Comes from the third cranial nerve which supply both eyes. When I immediately shine the light upon this indirectly constricted eye, it will be dilated instead of constriction. This paradoxical dilatation instead of constriction is called Marcus Gunn pupil. Really, these are the steps of the examination of the third oculomotor, trochlear and abducens nerve. Sometimes the examination may include questions about assessment of cranial nerve individually. If the question was to assess third cranial nerve individually, you have to perform these three steps: prime position, H test, and the reaction, light and near accommodation reflex. If the question was to assess the fourth cranial nerve, you have to perform the first of all prime position, this is one, and then to assess H test, especially this movement. If for example this eye had defect in the fourth cranial nerve, especially for this movement, bring the object in and especially down. Ask the patient to look at it from outer into in and especially down for the fourth cranial nerve, especially this step. And then this is for the fourth cranial nerve, is to perform Bolshevsky test. Bolshevsky sign or Bolshevsky test is designated as to see whether the eyes became parallel to each other with tilting of the head or not, because patient who had fourth cranial nerve defect, for example, in this eye, he will tilt his head into the contralateral or opposite shoulder to get more parallel eye. Okay? Because the defect here in the superior oblique, so his eye will be a little bit higher than this eye, and to bring both of them parallel, he will tilt his head into the opposite shoulder. We can perform Bolshevsky test in the following manner. I'll see both eyes and then tilt it like this and then tilt it like this, and to see how much it is corrected, whether it is corrected or not. These three steps for the fourth cranial nerve, and the sixth cranial nerve also by prime position and by performance of the H test, especially the outer parts, because the lateral rectus is supplied by the abducens by the abducens nerve. All these issues are about the examination of the third, fourth, and sixth cranial nerve.